Okay, I think we're live. So I'm excited today to be able to introduce to you and have a chance to communicate again with my great friend Veronique Mead. Veronique and I had a nice talk together that was on the YouTube channel from February of 2019. And Veronique, since you and I talked last, a lot of water under the bridge, a lot of things happening, but just by way of brief introduction, I wanted to say that Veronique is a physician. Family medicine, I believe, is your specialty. And some time back, you had some a health setback that really kind of began to interfere with your professional work as a clinical physician, and it kind of caused you to start going a different direction. And I know that you and I kind of got acquainted with each other because I was really focusing in my practice on chronic fatigue syndrome, and was also very interested in the work of Dr. Robert Navio, which I'm sure we'll talk about some today, with the mitochondrial cell danger response. And I think it was doing some online research that I came across you and your story and your work, and that's how we first got acquainted with each other. But this is a brief introduction, and I know that you've been up to some great things since we talked last, because I've been following you on your website. But I'm going to just turn it over to you and let you get started and sharing with me and with our viewers some of the things you've learned in the time since we've talked last.
Well, just to start, one of the things that you suggested we talk about today was really how do we get through the stressful times of what's going on right now. And maybe that's a place we can just start, because that's just affecting everyone. And, some of the thoughts, some of the things I've been noticing from hearing from my readers, and that I think you're hearing from your patients, are, some people are actually feeling better and less stressed because things slowed down for them and they've been able to work at home if they're able to work. And a lot of us who are introverts are finding sort of resource in the solitude during the lockdown that happened. And then there's a lot of people who are feeling a whole lot worse, feeling cooped up, feeling cooped in, feeling the fear that's happening around the world, and really feeling alone, I think, as well. And this whole thing that's going on, that's really all the different layers, can really trigger an unrelenting sort of sense of a lack of safety, not feeling safety. And one of the things that I really focus on my blog with the trauma piece is how a new stressor can really trigger old trauma and old survival, old threat responses, old cell danger responses that are sort of caught in a fight, flight, freeze state. So in a way, if we just keep thinking about it from this context of looking at symptoms as a threat response, then there are actually a lot of things that we can do. And so really the prescription, the foundation of how I would talk about it would be that the underlying thing that we can all do is, how do we create a sense of safety for our nervous systems in this moment, just in one moment, in the present moment. And I'll talk about 9 tips for that, and also talk a little bit more about what kinds of symptoms a lot of people are feeling right now.
That'd be great. One thing that might be helpful, without going into it for too deep, is a little bit about exactly your background and how you even became involved in the whole topic, and before we got into this pandemic situation.
Yeah, and kind of your question that you had earlier about what's been going on in the past year too, maybe. It's I actually left my career as a physician. My chronic illness, which was chronic fatigue, that ended up disabling me. I was pretty much housebound and bedbound at my worst for about 9 months. Started when I was a physician and I was teaching residents, and I actually left because I really felt there was something missing in what I could offer. And getting sick, I got slowly worse over 10 years. Some people get sick suddenly overnight. But I didn't realize what was happening. I just thought it was stress related. And I ended up retraining as a trauma therapist, a somatically based trauma therapist. And that's where I first started learning about trauma and how much more subtle it is and more pervasive it is than we realize. And I was in a psychotherapy program, so it was really about mental health conditions. And we recognize that trauma is a trigger for PTSD. But I got curious about how trauma, could it be a trigger for chronic illness? And so that's what I've been exploring for the past 20 years. And my health has gotten better as I've worked with it. A lot of the tips that I'll be talking about include the things that I've done and kind of learned from or tested out from firsthand experience. And my health is just so much better. So wonder if that's part of what you're curious about, or if you have another specific
No, but maybe just
helpful.
specifically that at some point you decided to found this website that you might tell us a little bit about, and all of the different ways that you've shared with people through that platform.
Got it. Yeah. When I was especially sick, I had been learning a lot about the trauma piece, and I was curious about how it affected my own health. And could my flare-ups be caused by triggers and stressors in the environment, like other trauma responses are? And everything I kept finding in the research made me so excited that I finally did start a blog to share the science, because this is not yet something we're being taught in medical training. And most healthcare professionals aren't yet being taught about the science that's coming out, that's been out now. And so I write about different types of trauma that are risk factors for chronic illness, how it's not in your head, how the science is actually showing that life experiences interact with our genes. And there's an epigenetic response because of that, where molecules attach to our genes and our life experiences contribute to whether our nervous systems and our immune systems are oriented more towards a threat response or a safety response, and how that can get stuck.
What about how the cell danger response plays into that? I think that's what fascinates me so much.
I think that, and the term, just the term cell danger response, really resonates with a lot of people. And that's the work of Dr. Robert Navio at UC San Diego, who published one of his first papers, I believe, was in 2014. And he's looking at how a cell, we think about the mitochondria, you mentioned this in the introduction, how mitochondria are really our energy centers, that's the focus. That's what a lot of us as healthcare professionals have learned is the primary orientation for mitochondria. And what he's discovered is that they also have a defense response, a threat response. And what Navio's work is really changing for a paradigm shift is that in this cell danger response, it can get caught like a trauma response that we see in the nervous system, so that it gets stuck in fight, flight, or freeze, or some combination of that. And that can take away, if that becomes a really stabilized, strengthened pathway, that can become our default pathway and lead to chronic illness and chronic symptoms. And that it's actually not a permanent thing or a broken thing. It's a threat response that hasn't gotten the message or the signal that it's over and that now we're safe.
That's what I find so exciting, and I've seen it play out so many times clinically, is how reversible it is. You know, that it's something that once you understand it and what's triggering it, it is actually something that can turn on and off quite quickly. And it's great once I can help people learn to get some degree of control over it. But it's one of the things from our situation in the community that seems to be playing a big role when people are feeling worse. And maybe we could go ahead and go into that a little bit now, because I know you've really been paying a lot of attention to that during the pandemic.
Yes, and I've been really curious how people are faring. And one of the things with the cell danger response, the CDR as they call it, is that if the mitochondria are completely or mostly occupied with protecting us and in that threat response, it has an impact on their ability to produce energy. And so a lot of us are feeling much, much more tired. That's a really common symptom I've been hearing about. And people are also having all kinds of symptoms, whether it's gut symptoms, like whether it's bloating or indigestion or constipation, diarrhea, sort of a little bit of an explosion in all these symptoms can be happening because our guts are the place where a lot of our assessment of the environment and that information comes in through the vagus nerve and up to our brains to give us a signal about how the environment is. So a lot of people are feeling much more fatigue, much more gut symptoms. I imagine you're seeing that and hearing that as well.
Exactly. And I do spend a lot of time telling people that when it comes to signals to the brain regarding danger or safety, that the gut is one of those primary avenues of information. And as you say, through the vagus nerve as a nervous response, but also circulating cytokines from the immune response that's in the gut as well. I find that that's a big issue as well, inflammatory cytokines. So I tell my patients that it can come through nerves and it can come through the blood and lymphatics as well.
Yeah, it's really the complexity of our systems and how much they're scanning the environment and taking things in and taking in information. And so there's the gut piece, the energy piece. There's also people's sleep is really affected for a lot of folks. A lot more anxiety, grief, depression, or even more like a hair trigger response of feeling irritable. And these are all just subtle versions or large versions of our own internal threat responses that are trying to figure out what to do in a setting where we really don't have clear information. The foe, the threat is invisible, and we haven't had a lot of trustworthy information, or we don't know a lot yet either. So those are a lot of the things that I'm seeing, as well as things like having more trouble concentrating or trying to get things done, but everything feels a little more like molasses or moving through molasses.
Sure. Do you hear people telling you about changes in thresholds of pain and even stiffness?
Oh, that would make a lot of sense. And you know, when you say that, what I think is also a risk right now is that for some people who have either done a lot of work, improved their symptoms, they may feel as though they've regressed and things have worsened again. And I think it's really just that we have a heightened stressor in our environments. And so things have increased, but it's not necessarily a full-blown loss of ground. It's just that our systems are trying to cope with more stress. And what you just said about the heightened pain response, it just makes me think there are also some folks who may get triggered who have been sort of, their systems have been trying to calm back down, and this has just thrown them over the edge. So some people may be developing new symptoms or getting diagnosed with a chronic illness at this point as well.
Well, and the other thing I would say that, we've been focusing in on the fact that the threat response and the cell danger response seems to have a lot to do with our immune capacity as well. And, people are really locked in right now. What do I need to do to keep my immune system strong and healthy to hopefully protect me, from things that will not be named here. But I tell them one of the first things they really can do and should do that can dramatically improve that is the state of their brain relative to danger versus safety.
I think that's actually the bottom line in this sort of this paradigm shift that we're starting to gain from the research that's emerging and how we think about chronic illness and chronic conditions and chronic pain, which I don't work with as much. I'm not as familiar with it, but all of this input, when we think about it and take a step back and think about it from a CDR, nervous system threat response point of view, it opens up the door for all the different things we can do that are really helpful in increasing the resilience in our systems.
Well, maybe we can get into that a little bit. think you've got a few tips for us there.
I do. And, just to give another sort of context in a way, neuroscientist Bruce McEwen was one who founded the concept of allostatic load, and that each additional stressor is something that adds more to our systems having to cope with. And so really what we're doing is we're counteracting that by adding up these different resources that can support the resilience in our systems, whether it's the immune system, whether it's getting the nervous system to feel more of that sense of safety, and so that it can affect and trickle down to all our different organ systems as well, including our guts. And
I like that we pile it on one straw at a time and we can take it off one straw at a time.
yeah, and one of the things I've started thinking about in this context about looking at chronic symptoms is these tools that we have create more space in our nervous systems, in our organ systems, in our bodies, in our minds. But they're creating more space so that our body's own innate ability to heal, our body's own innate ability to recognize safety can come back online because it's not having to struggle with as much input.
Sure.
And yeah, so the tips, I think of them as decreasing signals of threat and increasing signals of safety. And so the first 3 out of these 9 that I would put would be less input, decreasing the input. And a lot of people are already doing this, but some might need, in a way, a validation about why this is important. One thing would be less news. It can be not doing as much news. It can be titrating the amount of news, whether it's just listening to one trusted source once a day for a specific amount of time. But listening to the news and how it's spun or how it's presented can really be triggering for our nervous systems. And a lot of us with chronic conditions are especially sensitive, and we're empaths. And it's just that much harder to regulate right now. And so the less input we have, the more chance there is for our systems to have more space. I don't know, have you been finding that as well?
Yes, and I really feel like a lot of what we're getting through media channels is really almost there to generate more fear.
I think that's really been an orientation for a lot of the news outlets, has been more of the drama. And so that's another reason. And another way to sort of reduce the input from the news, we want to be staying on top of things, but there's also other places we can get the information that have a smaller input or less impact. So it could be something like you reading it instead of watching it. It could be watching it online through a Twitter feed instead of a whole news broadcast. And it could be that you really just stick with a trusted source, or that you have a sign up for a daily short summary from someone who does this summary of what's going on, so that you're really chunking down how much is coming in.
I like that. Yeah, I think that's good.
Yeah, in real estate, we talk about location, location, location. And in the trauma work, it's about less is more, and it's about titration, titration, titration. So if there's something you really can't stay away from, if you can do less of it because it activates your system. And you can also do something like listening to more news to get more information when you feel particularly resourced. That can be helpful as well.
Sure, great.
So number 2 would be, in general, this concept of making more space and slowing down. At the beginning, during the lockdown, people were saying, this is probably not the time that you're going to get in shape and do that diet you finally wanted to, and start that new work and that new project. And for some people, that's working. But for a lot of others, there's so much input coming from stress that's taking so much energy. It just takes more time to cope. It takes more brain capacity and energy to think about what you're going to do if you go out to run an errand. And when I was mentioning empaths for those with chronic health conditions, a lot of folks are feeling more anxiety, and it's not all theirs. And so just knowing that as empaths and super sensitive folks, we're often picking up on what's in the environment, and then knowing that it's not ours can help sort of create more space and validate too why we might actually have to slow down and do less and create more room in our daily lives. That can also include more structure. So some people are doing better with more structure, having a set wake-up time, eating at certain times, just like we do when things are running along in a smooth way. And that can provide comfort to the system as well.
I think too that we've seen some cases where the desire to accomplish things during this period of lockdown has ended up generating some degree of self-shame, which I really encourage people to have very realistic expectations about what they can accomplish, what they should set out to try to accomplish.
I've been working with that myself. I've been wanting to write more. And when you have this perspective around the nervous system, the CDR, that this is a threat response that's causing symptoms, and you have tools, we'll talk some more about them, you can try things using your tools and just seeing how much your system can do without sort of going over the edge. That can be one way to keep plugging away. And it can be that you give yourself permission to not have to do these things. And like you say, also let go of that shame piece as best you can, because this is a big event that's going on.
Exactly.
Yeah. So number 3 would be a short one. It's really about, again, it's about input. And one of the things I've found is I have less capacity for watching even movies or reading books. And so it's really about being more selective, and that's okay. So some of us may be using movies and online courses and all of what's available in a way as a distraction. And that can be helpful, but it can also actually take us so far out of the present that it's harder to come back, and that it's sort of, it's not actively providing more of that sense of safety to the system. And so it might be being selective and watching things that are really inspiring or soothing or calming. And like my husband and I recently watched The Biggest Little Farm. And that just came out in the past year or so. And there's a lot of challenges in it, but they overcome them, and they do it by stepping back and looking. And it was so inspiring. We watched it 2 nights in a row.
I know that I've been found a lot of satisfaction in finding a few outlets that actually spin things from more of a hopeful perspective.
Exactly.
And that's been very reassuring to me that, you know, there is a light at the end of the tunnel, and it's not a train coming at us.
Exactly, because this will pass and things will shift. And the more we can do that provides that angle that has the hope in it, the more it supports that process for our systems to have more resource. And just naming that, there's a Facebook page called The Trauma Project. And Carol Ann McBride, who runs it, provides a lot of information of what's going on, but it all has a positive bent to it. And so it's actually one of those Facebook pages where you can get information and feel encouraged and feel like you're part of a community at the same time.
That sounds like a great resource. Thanks for sharing that one.
Yeah, The Trauma Project. So this next group of 6 examples is really about how do we cultivate resources, and
Great.
how do we send that signal to the brain and the nervous system and the cells of safety. And so number 4 I think of as, and most people are going to be familiar with this one, but it's about self-care. And, you know, whether it's diet or exercise or having a schedule or having a mind body practice like meditation or yoga or Tai Chi, making sure you really do get that sleep at night, this can really help calm things down, support the immune system, help decrease inflammation. Um, a lot of us would really love comfort food right now. And so it's really about what resources you most. Does eating in a way that feels more comforting, that might not be the normal way you eat, does that actually help? And if so, wonderful. And if not, you know, for my own system, I've needed to actually calm down and decrease I've had food intolerances over the years, overcame that by setting some boundaries. It was very unexpected, but it was really a process of building up the sense of safety in my system so I could eat everything again. And then with the pandemic, it's been more about cleaning things up again to decrease the load on my system.
Sure. Yeah, we talk to our patients a lot about nourishment, about, you know, maybe comfort foods are okay, but try to eat chemically clean as much as
Right.
you can and as
Yeah.
nutrient rich as you can. And in some cases, unfortunately, because our food doesn't have the nourishment it used to have, that can mean that there's a place for nutritional supplementation in some cases too. We've been talking to a lot of people about vitamin D and vitamin C, which is getting a lot of play in the press as well.
And you talk about nourishment, and if we think about the big picture of that, this concept of social distancing and the 6 feet rule, what the trauma community is really thinking about and kind of putting a slight shift on it is actually it's about physical distancing, and that the social part, even though it's harder to have that connection, finding the ability to have social connection is another really critical piece of resource and nourishment. And so for folks who are feeling alone, especially, but anyone, having more contact with your community, whether it's phone calls or Zoom sessions, or even writing, you know, exchanging emails, whatever it is, that can really help combat the lonely piece. And so that's another part of self-care that we don't always think about in a medical setting, is this social piece that actually supports the social nervous system. And that's the part of our system that thrives in connection and that is actually able to dampen fight, flight, freeze because of that sense of safety that comes from being part of a tribe.
Exactly. Ventral vagal.
Ventral vagal,
I like
the
it.
vagus. Yeah.
Exactly.
Yeah. So I would go on to number 5. Actually, I've mentioned it before, and that's just adding structure into your day or into your week. And number 6 is one that I was practicing when I was in Oregon recently. I went to do a writing retreat, and the lockdown happened while I was there, and I extended by an extra month. And I was near the beach. And so that was actually a huge resource for me. And number 6 is about what makes you feel even a little bit better, whether it's what helps you feel more comfort or what helps you feel a little more pleasure, and it might be just this much, or relaxing a little bit. And it doesn't have to be big. So these are things like certain foods that we just talked about, but it can be things like the sheets on your bed or on your pillow and the softness that you feel. And going one step further to really in the present moment track what happens in my system when I feel that softness of that sheet. Because what will happen if we take it for just briefly a little bit further is that it's taking that signal to the brain and the nervous system. And then the system is doing something with it, and it generally is doing something that settles the system just even a little bit. So maybe there's a downward feeling, or maybe there's a little relaxing that happens in your belly, or just feeling a sense of a little more hope that these pieces convey.
Looking at that beautiful backdrop behind you makes me want to say that a lot of my patients have actually found that nature and even grounding with the earth. I bet you if you had a few chances to get your bare feet on that wet Oregon sand, that you found that to be pretty calming as well.
It really was. Yeah, I went for a long walk every day, and the listening to the sound of the waves, the vision, the visuals of the waves. I walked home late one night and the peepers were out, the little frogs in springtime. And so any little thing, so if you can get out in nature, that's huge. And if you can't, it can be watching nature program or looking at pictures of whatever kind that are resourcing to you. And so, it can be feeling the water when you take a shower. It can, all these little things that are working with sensation, vision, sound, they're all working in the present moment to change that sense of the signaling in your system.
Sure. Good tip.
So the next example is, I think about it as using an example of getting groceries as a way to highlight how we can use some of these tools. Because, of course, getting groceries has been really anxiety provoking for most of us. And it's a process where we're beginning to see how people are adapting, making changes. It's not as stressful for a lot of folks as it's been. But the concept of titration comes back here. So it could be that you titrate the stress on your system, if it's stressful for you, by having others get it for you or having it delivered, if that's an option for you. But you can also titrate the process by going yourself. A lot of us with chronic health conditions are more vulnerable. And so even if our condition might not have an official name or diagnosis, going during those hours that the stores have, for example, ours has the 7 a.m. The first hour is for folks who are older, more vulnerable for whatever reason. They don't ask any questions. That's another way of titrating the stress. One of the things that I find the most helpful, when I was in Oregon, I went to the grocery store there. I didn't know anyone. I'd never been there before. So it carried extra stress. And what I used was the concepts about what makes you feel even a little bit better. Item number 6. I used it as a way to sort of imprint the positive resourcing things in my system, so I wasn't just getting the stress and trying to get it over with. So there were 2 ways to get to the grocery store. I picked the one by the ocean because it was more beautiful. In the parking lot, there was a beautiful evergreen tree in a shape that's really unique and different. So I actually spent a minute in the car just taking a breath before going into the store. And when I was in the store itself, it was listening to the music. I actually liked it. For me, it was country western. And that first time I went, my anxiety was really high. It was the first time after the lockdown. And a love song came on. And it made me teary. And the thing about teariness at a time like this with stress is it can feel like we're being weak, but it's actually a present moment experience where you're just taking in the enormity of what's going on. And you're letting something touch you a little bit. And that actually helps to thaw what a lot of us have as a freeze response, an overwhelm response, where we might feel numb. And so letting in something like that, and maybe you want to bring your iPod and listen to the music that's a resource for you.
Sure.
And yeah, like there's just so many different ways once we understand how this context works. The other piece was that once I got in the car and I was driving home that first time, I had more tears, and it was this sense of relief. And it's sort of, you think it's a little thing, you think you're having an overreaction, but really it's a normal reaction to the situation that's been going on. And having your system that went up a little bit in stress to kind of keep you safe as much as it can. And then having that signal again of safety come in so that your nervous system gets it's okay, I made it, things are okay right now. And there's another level, even getting home. Some people will have that sense when they get home. Maybe it's that their kittens meet them at the door, or that was one of my readers had written about that. And that was her signal. It's like, oh yeah, I'm okay. So it could be looking around, but actually specifically orienting to what tells you that you are okay in this moment is actually a really significant way to counteract trauma, minimize stress, and provide the information to your system that you are okay in this moment.
You know, I want to interject that not only because of the trauma of the conditions we're in now, but also just because of the degradation of our environment that's happening so quickly around us. I find in my practice that emotionality is something that so many of my patients struggle with, and it's oftentimes new to them. But I think it's always important for me to stress to them that we see this as part of this process of the brain's response to danger, and that it doesn't have to even be permanent. That so often, if we can learn to help the brain to migrate back to that place of calm, tranquility, and spend more time there, that often this emotionality tends to dissipate quite a little bit. So it's, you know, people, I think they get embarrassed by it or frustrated by it or even angered by it, but it's just part of the process. I see it all the time.
So emotionality, do you mean that people are more irritable or they're crying more
No, the
easily?
teariness that you mentioned, you know, just,
Yeah,
you know, it's
yeah,
like your feelings are on your sleeves, and, you know, just,
yes.
yeah, everything just happens very quickly and almost uncontrollably, but it seems to be part of this process.
Yeah, and you know, there are signals that we can learn to recognize that tell us that our system is actually coming down from a stress response. And that crying can actually be a form of release. And I would imagine that people coming to see you in the office may feel relief to be heard or seen or believed. And also to actually connect with someone who is caring and regulated themselves. And that can allow, I'm having goosebumps just talking about it right here. And I actually feel a little teary.
There you go. That's what we see. Yeah.
And this is actually about coming into connection in a world where there's an overwhelm of feeling disconnected. So,
I think there's also something about this chronic illness, chronic fatigue, and these other things that we've been talking about that unfortunately, because of some of the training of some providers in Western medicine, it automatically genders this disconnection. It's really
yes,
sad. I think it's changing, especially with some of the younger people coming through training, whether it's younger doctors or people in other different forms of the healthcare industry, that people are beginning to be much more tuned into the connection issue. But you know, I don't know how many of my patients just tell me, you know, it's all in my head. There's nothing wrong with me. I just need to have less stress, and you know, it's just almost glibly thrown out to them. But I just find that it's just so reversible if you can learn to help people understand where it's coming from. And you know, you're right, people need hope that, you know, somebody like me has seen people like them and has seen people like them change for the better, and find that resiliency and see those symptoms dissipate.
yeah. And it's also that human factor where we can't always do something, or we can't always do something in the moment, or it's not always clear what the path is, but that we're in it together, we're going to work together, and that we will find a way together. And that's the power of the ventral vagus, that social nervous system piece also, is that signal again to the brain that you're not alone and that you are part of a team. And so that's really a huge antidote to having stressful events become traumatizing, and just having them be stressful events so that when the stress is over, our systems can come back down.
Exactly.
Yeah.
Great point.
So Number 8, I would think of as, with so much going on in the world right now, I know for me, I was feeling a sense, especially early on, that I wished I could be doing more. That if I was a physician, I could be at the front lines and I could be doing something more active. And part of it was this longing to be part of that tribe, and taking action. And so for some folks, taking action could be participating more fully, whether it's activism, demonstrating, volunteering and making phone calls, or because they're already out there in the positions where they're providing services that are so essential. But for a lot of us with chronic health conditions who are already more vulnerable, I want to name this piece that the work we're doing for ourselves and with our nervous systems, and to regulate, to keep our systems, to reduce that stress, and to work with our own selves by not blaming ourselves or shaming ourselves, by having compassion for ourselves. This is actually a contribution we're making to the world. When we are able to take care of our system and be more connected or regulated, it actually helps anyone we come in contact with to also be a little more regulated, feel a little more safe. And even if it doesn't happen directly with contact, there's an energetic that happens as well. And so everything we do to work on our own personal process and our own health, I think contributes, and it's invisible, but I think it's actually a really powerful thing that we offer.
Definitely. Yeah, quick aside to that, we have an IV nutrient center here in my practice, and we have people coming in for various treatments IV often, and a lot of times they're in a kind of a group room, but the energy that flows in that room, and the therapeutic effects of just what you're talking about, we've seen that so many times.
Nice. It's like an added bonus, right?
Exactly.
Yeah,
A lot of people have told us that's part of the process for them.
exactly. Exactly. So that contact connection piece is really a thread that weaves its way through a lot of these things that we're talking about for tips,
For sure. And people like to, do just what you said, to migrate from victim to treating entity. In other words, they like to share, and they like to take what they learn that helps them and provide that for others. And that's a big part of that for sure.
And
I always tell my patients how much I learned from them. I always tell them, please share, because I learned so much from my patients teaching me, or from people I work with teaching me.
that makes me think of number 9, which is really, I have relatives with chemical sensitivities, but they've learned so much over the years on how to stay safe from invisible things that they had a lot to offer. They knew what kinds of non-toxic products they could recommend for killing off the virus, for example. They have a lot of familiarity. A lot of us who have been chronically ill, homebound, have a lot of sense of how do you do the home thing. And so, yeah, there's actually a richness in this community of people who have become experts because of what they've been living through. And so
Absolutely.
number 9 is really about, we have a lot to offer, and anything we can do that can help actually can make us feel better too. So it could be that we are in a position where we could hire someone to do a task or do something for us, or that we can support someone, or that we can give a compliment to someone, or that we can call someone who might be feeling even more vulnerable than we are right now and offer a shoulder to lean on or encouragement. And that can be another way that we can really continue to shore up the social nervous system and that sense of the signals.
Sure. Now, as we begin to start wrapping up, I would like you to spend just a minute maybe to give our viewers some resources of some places that they might be able to plug in a little bit more to learning more about you and what you're offering for people right now? I know you've got some summits coming up and some blogs that you've contributed to and so forth.
You know, the easiest would be to find me. My blog is called chronicillnesstraumastudies.com, and they can find articles there. I have more than 20, 25 free ebooks that they can download, whichever ones resonate. That it's all about the trauma and chronic illness connection, the science that shows how it's not psychological. In the menu, I have a place called Tools, where they can look for tools that are specific that I write about, and for the process of healing and how it fits into this nervous system perspective. And anything they download requires an email. It's free, but with their email, they're subscribing to the blog, and they'll receive blog posts. I've written about COVID and a few personal experiences I've been through. And they can unsubscribe anytime. If it feels useful, they can stay on and learn more about the upcoming summits. I'm in one next week that's about healing digestive pain with a nutritionist. And we're not talking about diet. We're talking about all the other things that support the dietary piece as well. So I'll be naming some of the things that'll be ongoing resources on the site.
That's fantastic. Yeah, I've been on your email list for a good while. And I always look forward to your latest contribution, what you've been up to. And I've learned a lot. So, well, I really want to thank you for taking time out of your schedule to be able to share some of these things with our followers. And as we wrap up, is there anything else you want to comments you want to conclude with?
I think this is good. I think there's a lot of resources and hope out there. And I'm so glad to have this conversation with you, Wally. Dr.
Great.
T.
Veronique, so nice to chat with you again, and you stay safe and God bless you.
You too.